Thank you for this opportunity to talk about some of the work my team has recently been doing at the FSA. So I'm going to begin with a really brief introduction of the FSA and how we perform risk assessments. Then I'm going to discuss two recent risk assessments my team has performed and how epidemiological data supported the risk characterizations that we came to. And finally, I'll conclude with a little reflection on how the epi data also influenced the risk management decisions that came out of these risk assessments. So the FSA was established in the year 2000 after several food safety crises in the UK, like the BSE mad cow epidemic. We are an independent statutory body where our role is written into law, and we operate across England, Wales, and Northern Ireland, and collaborate closely with our sister organization, Food Standards Scotland. Our mission is food you can trust, and we aim to be seen as an organization that bases its decisions on the best science and evidence available. So after our exit from the EU in 2021, we had to design our own risk analysis process, and we followed Codex guidelines for that, where there is the separation of risk assessment and risk management, but both teams will come together to work on the risk communication strategy at the end. So the risk assessment unit at the FSA is composed of about 90 risk assessors, and it's split into 5 different teams investigating different food and feed safety hazards. And our risk assessments also follow Codex guidelines, and including these 4 different sections in the risk assessments. And for the epidemiological data that I'm talking about today, all of that was contained in the hazard characterization sections of the 2 risk assessments I'm discussing. So all of our risk assessments are quality assured by the Independent Advisory Committee on the Microbiological Safety of Food, and we also have recently adopted their multi-dimensional representation of risk for our risk assessments, and you'll see an example of that in the first risk assessment I discuss. So on to the first case study, and this is your first and possibly only microbiological risk assessment talk of the conference. So we were notified by the UK Health Security Agency in mid-2021 that there was an ongoing outbreak of Listeria monocytogenes and that they had linked it to smoked fish. One of the early cases in this outbreak was a pregnant woman, and that led to the different UK public health agencies reviewing their advice about what was safe to eat during pregnancy, and that identified that there was actually a discrepancy in that advice across the 4 UK nations. So to support any official change in advice, a risk assessment was requested in mid-2022, and we completed that risk assessment in collaboration with Food Standards Scotland. Now, since this risk assessment was also to support an outbreak situation, we delivered this risk assessment at pace, and the first draft of it was completed in just over 3 weeks. And because of the speed with which we did this work, we chose to do a qualitative as opposed to a quantitative risk assessment. So the risk question was, what is the risk to UK vulnerable from Listeria monocytogenes in ready-to-eat smoked fish? And vulnerable consumers in this risk assessment included the elderly over age 65, pregnant women and their babies, and also the immunocompromised population. So the first thing that we looked into was the national surveillance recorded for Listeria infections from the UK Health Security Agency. And so the graph there is showing incidence split down by age and sex for Listeria cases in 2021. And you can see that there's a little peak in incidence in women of childbearing age, and also an increase in incidence in the elderly populations. And the data from UKHSA also indicated that pregnancy-associated cases accounted for between 10 and 20% of all Listeria cases in the UK in any given year. So this was evidence that in the UK, vulnerable consumers were more affected by Listeria. Beginning in 2015, UKHSA started whole genome sequencing of several key foodborne pathogens, and that has allowed them to be better able to detect outbreaks and also identify the contaminated source. So this is data from UKHSA about the number of cases in the UK of listeriosis that have occurred that were specifically linked to smoked fish. So you can see from the years 2015 to 2019 that there were 5 incidents of Listeria from smoked fish, leading to 7 cases and 3 deaths. And the reason that it's split into two different rows like that is the amount of evidence that was available to link the outbreaks to smoked fish, or just the cases to smoked fish. So in the top row, there was only microbiological evidence available, meaning that there was a similarity in sequence between the isolate that came from the case and from a food or environmental isolate from a smoked fish business. In the second row there, that means that there was also epidemiological data to link the cases to smoked fish because it was included in their food history. It looks like there has been a pretty significant increase in the number of cases linked to smoked fish and listeria in the UK in the past few years, but that is because of two different outbreaks that have happened from smoked fish and listeria. And one of them was the outbreak that prompted this risk assessment. And so just for comparison, I have along the bottom there the total number of cases of listeriosis that occur in the UK over the past 10 years, or actually from 2015, just so you can see how many are linked to smoked fish. So it is typical for our team when we perform risk assessments to do a systematic search of the literature to identify outbreaks that have occurred from that food pathogen combination, as it's a really good indication of how frequently those infections occur and also a good indication of how severe those infections might be. So when I did this for listeria in smoked fish, I identified 8 different outbreaks that included enough detail that I was able to extract a majority of the data that is included on this table. So those 8 outbreaks occurred between 1994 and 2020, and all of them were in EU countries. The cases ranged from 4 to 27 in the 8 outbreaks with a total of 99 cases. Deaths ranged from 0 to 5 with a total of 19. And in 6 out of the 8 outbreaks, vulnerable consumers comprised a majority of the cases in the outbreak. For one of these outbreaks, it was a instance of febrile gastroenteritis, so it was not invasive listeriosis, and it was in the immunocompetent population. And in the final outbreak, the case history or the health status of the cases was not reported. Similarly, for 7 out of the 8 outbreaks, it was linked specifically to cold smoked fish. So our systematic literature search also identified this paper from German colleagues, which we included in our risk assessment, but the outbreak data wasn't broken down enough for us to be able to include it in the table that I just presented. But it was really good evidence that smoked fish was a pretty good source of getting listeria infections, as they identified 22 individual outbreaks that occurred in Germany from listeria from smoked fish, but this one also included cured fish. So as I said, we performed this risk assessment at pace, so we were not able to do our own quantitative modeling of the risk of infection for UK vulnerable consumers. But fortunately, there were several published quantitative risk assessments available. And I have here an example that we included in the risk assessment of the mean risk of getting listeria from smoked fish based on French epidemiological data. And all the data was fairly consistent in indicating that vulnerable consumers had a 10 to 100 times more chance of getting sick from listeria in smoked fish compared to the immunocompetent population. So this is the risk characterization that we came to for this risk assessment, and I have here the scales that are recommended for use by the ACMSF multidimensional representation of risk, and it's based on really standard scales that are have been produced by other risk assessment organizations. And so based on the outbreak data that I presented, we decided to split the risk between different products, between cold and hot smoked fish. So the frequency of getting listeriosis from smoked fish for cold smoked fish we decided was low, meaning that it was rare, but it did occur. The frequency of getting listeriosis from hot smoked fish we determined was very low, meaning that it was very rare, but it could not be excluded. And because listeria is known to cause invasive disease in vulnerable groups, and it has a high case fatality rate, the severity of the disease we determined was high. So how did the epidemiological data help us come to these risk characterizations? Well, with the whole genome sequencing data, we were able to confirm the link between the contaminated food source and the cases. The data that we had from the quantitative risk assessments and also the incidence rates from UKHSA suggested that vulnerable groups were more at risk compared to the immunocompetent population, and therefore it was deemed appropriate to issue advice specifically to vulnerable groups, specifically about smoked fish. And it also allowed us to separate the risk characterization between hot and cold smoked products. And that turned out to be really advantageous for our risk managers because they were then able to tailor their advice specifically to cold smoked fish and provide several alternatives so that vulnerable groups could still safely eat this product and not lose it out as an important source of potential protein or nutrition. So now, a second case study from my team. So in 2021, it was widely reported in the media that there was an outbreak of avian influenza in commercial poultry and wild birds. Because it was being reported on so much in the media, the FSA risk managers wanted to ensure that the advice that they had about handling bird products was still appropriate. So there had been a risk assessment done back in 2015, but since that time, the FSA had changed its advice about runny eggs, saying that it was safe for vulnerable consumers to eat less than thoroughly cooked eggs if they had been produced under the British Lion Code scheme or similar schemes because of the work those schemes had done to reduce the amount of salmonella in UK eggs. So the risk question for this risk assessment is, what is the risk to UK consumers of becoming ill with avian influenza from handling or eating poultry products, specifically commercial poultry, wild game birds, and eggs? As I mentioned, there had been previous risk assessments on this, and they had concluded that there was no epidemiological evidence that humans could become ill from eating contaminated food if it was thoroughly cooked. But at this point, we're also interested in less than thoroughly cooked food, and these risk assessments also identified the fact that it was not impossible, not impossible to become ill by taking in avian influenza virus from food. So there were some very rare cases reported in the literature of people becoming ill after doing things like drinking raw duck blood, and there was also evidence from animals that they could become ill if they were fed infected poultry. So for our current risk assessment, we wanted to update the search to see if there was any new epi evidence available since 2015, and we were really hoping that there might be some research specifically on less than thoroughly cooked products. This systematic search of the literature was done in December 2022, so about a year after the outbreak had started. And while there was plenty of new research, there was absolutely no epidemiological evidence still that avian influenza virus could cause infection in humans when it was consumed through food. So this is the risk characterization for that risk assessment. You can see that, again, we broke it up into a lot of different products because that allows our risk managers to really tailor their advice. And the frequency of occurrence ranged from negligible for commercial chicken and turkey, because that's usually thoroughly cooked, which would eliminate the virus, to low for people that process game birds at home, so they're doing their own defeathering and butchering. And that's mostly because that also introduces the chance for inhalational infection, in addition to cross-contamination or ingesting it. And overall, our risk characterization was very similar to the one that was concluded in 2015, that it was very low risk to the population of getting ill from avian influenza from contaminated bird products. So the policy advice was they decided that it was still appropriate what they had in place, but they did put an update on the food.gov website saying that the evidence had been considered and that the advice that they had in place already to hygienically handle food and the recommended cooking temperatures was enough to mitigate the risk of getting avian influenza virus from any contaminated products. Oh, that's it. Conclusions. So, as I said, we did the smoked fish risk assessment at pace. So we didn't have time to do any quantitative modeling based on UK data. We also didn't even have time to grade any of the evidence that we included. But because there was so much evidence available and all of the evidence was really consistent, we were able to be really confident in the risk characterization that we developed. The epidemiological evidence was also key in our decision to split the products in the risk characterization between cold and hot smoked fish, which, as I said, really allowed the device to be tailored to vulnerable groups and what they could do to more safely consume the product. And from the avian influenza risk assessment, and it might be an unpopular opinion at a conference dedicated to the use of epidemiological data in risk assessments, but sometimes the complete lack of any evidence can be just as informative in coming up with your risk characterization as plenty of evidence. So some next steps for our team based on these two risk assessments is we're really trying to increase the way that we're using molecular epidemiological data in the work that we do. So that smoked fish outbreak that I mentioned, the strain that was causing it had a very unique profile of virulence factors in the Listeria monocytogenes, which meant that it was causing severe illness even though there were really low doses present in the smoked fish. And so we have asked our scientific committee, ACMSF, to come up with a report on how strain level differences between different bacteria might influence both the frequency and the severity of infection. And we're also working with UKHSA to increase the sequencing of food and environmental isolates from businesses, as that will increase our ability to detect outbreaks and find the source of them. And that is part of a wider initiative, the PathSafe program, that is being led by the FSA. PathSafe stands for Pathogen Surveillance in Agricultural, Food, and Environment. And that is a big initiative to increase the data sharing between different UK organizations to help with the detection and surveillance of foodborne pathogens. So both of these risk assessments are publicly available at the food standards websites. I did not write these risk assessments alone, so I have to thank all the other authors. And with that, I will take any questions.